everyone, good morning. I hope you're all doing fine. Well, I would like to talk about something I believe is very, very important for us to know this morning. It's something that I've seen again and again, and it's like an issue that needs to be addressed because I know that a lot of people are aware of these things, they've heard of it, or it has even happened to them, but they don't know what to do, how to go about it whenever they are encountered with this situation. And it's something that having a knowledge about would help save a life, if not yours, at least somebody around. And that's convulsion in pregnancy, what we call eclampsia. So what is eclampsia? Eclampsia is when there's generalized, okay, I'll just give the medical definition, is when there's generalized tonic-clonic seizures in a woman with pre-eclampsia. Now, what is pre-eclampsia? Basically, pre-eclampsia just means when a woman who did not have hypertension prior to pregnancy develops hypertension, and then when they check her urine, too, there will be something we call proteinuria, where the kidneys start to I would say leak protein. So the kidneys are not supposed to leak protein, but when this happens and then hypertension in the woman, we call it preeclampsia, and it can be a pretty dangerous condition. So the best way to prevent eclampsia, which is the convulsion in this in with background preeclampsia, is control your blood pressure. Monitor it as often as possible. For every pregnant woman, it is very, very essential that you know your blood pressure at every point in time. Check it as often as possible. Once it's going high, you put in the necessary measures to ensure that it is brought to the normal level. And even usually during the physiology of pregnancy, during pregnancy, it's noticed that the blood pressure naturally comes down due to some body mechanisms that come into play during pregnancy. So ideally the blood pressure should be coming down. So when it's going up, you know that yes, there's a problem. So the best way to prevent these convulsions is to control the blood pressure. And what do you do when this convulsion has happened? One thing to help the woman is that by the time, if you ask a lot of Nigerians, what do you do, especially children, what do you do when somebody's convulsing? They come up with different things to do, especially as Nigerians. Like I've heard really horrible stories of what people do to children or whoever they see convulsing. But the best thing to do is just take away whatever is around her that can be harmful to her, calm her, ensure that she's lying on her side so that she doesn't aspirate whatever is coming, secretion is coming out of her mouth, and just start putting measures in place to ensure that you take her to the nearest hospital where they can do something for her. Because what happens is with each convulsion that she experiences, the blood flow to her brain reduces, and with each episode of this convulsion, it can cause more and more damage to the woman. So we don't want these convulsions. We try to avoid it as much as possible. And there are a lot of predisposing factors, but literally any woman who is pregnant can be predisposed to this convulsion. So in subsequent videos, we'll still talk more on this, as there's a lot to know about convulsions in pregnancy. Thank you. Have a lovely day.